President of the Black Physicians of Utah, joined me to talk about whether that's what we're seeing here in Utah as well. And he tells me kids often need to be hospitalized for 3 to 5 days due to depression or suicidal thoughts. And many times that process is initiated in the emergency room.
I've seen these lengthy stays more so in rural areas, but it definitely can happen in major cities as well, just because capacity hasn't kept up with the need.
When you talk about capacity, are you talking about just providers that are outside of the emergency room? What exactly is happening?
There's just kind of a couple reasons. Part of it is there's a workforce kind of bottleneck. Decades ago, a long shortage of child and adolescent psychiatrists and mental health clinicians. There's limits where these units can safely operate. So the staffing ratios, for example, I know that a child is more likely to be admitted and get out and have a shorter ED stay if they actually present between Monday through Friday before 9 o'clock in the evening. If they come on the weekend, many hospitals, particularly ERs, don't have additional clinical social worker coverage to come in and do the additional evaluation work and calls to surrounding pediatric mental health institutions to get them inpatient level care or even residential treatment outpatient, sort of that bridging between someone having to go fully inpatient. They can do something where they can kind of stay at home, but then go to a day program that can assist them as they try to heal from their behavioral health disorder or try to seek treatment. But yeah, sometimes it's just as simple as we don't have someone that'll come in, and so that can come in and do the evaluation. So that's an increased burden on the ER doc, the nurses, when we're still trying to take in further patients, and we're trying to, and so sometimes they don't get optimal care. They have to wait for someone to come through and do the proper evaluation for them to get admitted. Now, mind you, the ER staff is capable of doing this, but when you have 2 or 3 patients at one time, you're having to have someone, especially if they were suicidal, you need now someone to watch the patient. So now it's a one-to-one. Sometimes it's a nurse. So that nurse is now pulled away from providing care to other patients because it's a weekend and they need someone to watch the child in the room. And often that cannot be left to a family member because often a family member is sometimes part of the cause or the trigger that led to, say, a suicidal attempt or worsening depression. So there definitely is an increased burden that can occur. And some of it is just workforce availability after hours and on weekends. But also it's just many of our states just don't have sufficient facilities. You know, often when I'm working in the emergency room in northern Minnesota, there often isn't a facility near within, say, 50 to 100 miles of a hospital that I'm in or the ER that I'm working from. And so I actually have to call other states. So I have to call South Dakota, North Dakota, just to be able to get a child admitted. And so that takes time. And there's often protocols where many facilities say you try these first ones, you know, you kind of go, this is the closest, then you go farther out, then you go farther out, and you're waiting for evaluations and seeing about bed availability. And there's sometimes a wait list on top of that for these facilities. So it's compounding factors, but often it really comes down to their pediatric capacity has shrank alongside adult beds as well for mental health access ever since the 50s.
I guess the good news for parents is that they can turn to the emergency room. We don't want to discourage people if they have an emergency, definitely to go to the emergency room. But it does raise a whole variety of concerns and societal concerns, too. I mean, that's not the best place to get mental health treatment.
No. And often, many times, the acute issue of suicidality will have resolved within a few hours of them being there, sometimes especially if a substance was involved that led to the suicidal thinking, and if someone is able to have a good social support structure that is available to them right outside of the ER, where it's like, hey, you have reliable parents. Now that you're aware of this, you might not have been aware. Now there's increased sort of attention and fixation on helping the child, and they don't necessarily need to sit in our room for 2, 3, 4 days. But yes, I definitely would encourage, do not try to keep a child at home if they're showing signs of worsening depression or suicidality. Definitely still seek ED care. Sorry.
No, no. What are some key things maybe that we can learn or parents can maybe see to maybe prevent having to end up in an emergency room? Are there some key things they could be watching for so that a situation doesn't escalate to that point?
That's like saying, cannot predict if someone's going to attempt to take their life. There are some warning signs, I could say, but it really depends on the age group. And I can go through just a little bit of that. So let's say, for example, so Back to School Mental Health was an event that our Mental Wellness Alliance, our mental health arm to address mental health equity in the state for Black and marginalized groups, and that happened just on August 16th. And this was one of our topics: is how to be aware of emotional and physical signs of worsening depression or anxiety that can lead to suicidality. So one of the first things is a child becoming more withdrawn. I can see this sometimes more in female students or younger female adolescents will become a little bit more withdrawn from social media, their friends. And then when I've seen in males, when they're presenting worsening depression, they will actually have increased anger. And as some people would say, even as young as 8, 9 years old, you may see them breaking more things, yelling, getting into fights unnecessarily. This is often an underlying sign of untreated depression for a particular child. And then it takes a way to ask these questions, often with the assistance of a school counselor or a teacher or someone else that is able to be kind of that liaison between school, because there may be bullying going on at school. There may be bullying that's occurring online that's affecting this child's mood. So I think someone does not need to sort of have a hawk eye on their child at all times, but being more withdrawn from social media, not wanting to socialize with others, is often some early signs that depression is worsening. And then, of course, if you're seeing something such as self-mutilation, where there's cutting, or your child's starting to wear long sleeve shirts or long pants in the middle of the summer, it doesn't seem to make a lot of sense. They're no longer wanting to go to the pool because they're getting some relief with cutting. That can also be an early sign of suicidality.
Yeah, it's not simple, though. Oftentimes these things will come out of the blue for parents, right?
Yeah, and I think it's sometimes I think a lot of it comes with building the relationship with the coaches, that maybe if your child's in a sport, or particular teachers, to understand I notice their grades are going down. Is there something else that I'm not aware of?
Dr. Ferguson says this will continue to be an issue nationwide until more resources are devoted to mental health treatment for both children and